Hi everyone, this is Mohammad Ali Raza. Today we are going to walk through the slides about the cybersecurity framework which are being used for our Augusta hospital system. So in this slide, we have defined, we're gonna use NIST as a security guideline. That's gonna basically provide us the cybersecurity framework, and we are going to adopt this NIST framework to improve the cybersecurity. So one thing I would like to highlight here, that's not generic for the hospital, that's going to be applicable to any organization. However, we are adopting the NIST security guidelines since that provides the industry standards, security framework, uh, holistic guideline, and the detailed steps by which we can mitigate and we get all of the security threats and the risk. So, uh, since we are the hospital system, so that is we can also use this in our hospital system as well. The next slide that is about the cybersecurity framework which we are going to adopt, and this is a cybersecurity framework provided by the NIST guidelines. So we need to get it implemented in our uh, infrastructure. So this is not only from the implementation perspective, that does involve different processes as well as the different security policies as well as the implementation. So in the very first step, the very first step is identify, then protect, then detect and respond and recover. So it's a continuous security life cycle which we need to keep working over the span of time. So it's the never ending story, right? So in identify, we need to identify the security threats, and that's how basically the risk management and the risk management strategy comes in the picture. So in this stage, basically all of the critical systems and the infrastructure need to be identified, and also the risk management need to be done at this stage. What are the critical services need to be protected from the security threats? The next one is the protect. How we gonna protect uh, our infrastructure, our data, as well as any critical services. So since in Augusta hospital system, our main concern is to protect the personal health information of the customers. So that's gonna help us to protect any kind of customer PHI information and any hospital system assets. Detect this stage basically involves promptly discovering breaches and other separate security events like ransomware attacks, and then how to mitigate those. The next stage is the response stage. After detecting any abnormal activity or the malicious activity, or when if we are breaching data, if in the case of the data breach, how Augusta hospital system need to respond. So that is also one of the crucial stage. The next and the last stage is the recovery stage. In this stage, hospitals system security team basically they need to recover the system, and they need to restore fully functional after a data breach. So these are the basically different stages defined by the NIST guidelines, and we have to basically fine tune and define the security guideline for our Augusta hospital, and we need to keep following that. The regulation requirement for Augusta Medical Hospital System, since this is a healthcare industry, so we need to follow some of the healthcare security guidelines and the regulation. So there are a couple of security guidelines which are important in the US. So five of them I have found, and five of them we're gonna discuss it. So very first one, which is the federal security compliance which we need to follow if we are the healthcare industry, that is the HIPAA. So HIPAA compliance basically compromises the rules of the privacy and the security breach notification. It protects the personal healthcare information of any customer, right? So that is applicable to all of the healthcare provider, and they need to make sure by securing personal health information which is being shared by the different customer. Either it would be like in an electronical way, in on a written way, or either it would be oral. It doesn't matter, it would be an electronical information. So that's how like the HIPAA compliance we need to always regulate, and we always need to follow. The next one is the high tech. High tech, that is the same like HIPAA. However, it means the electronic information. So HIPAA basically covered, high tech basically covered the HIPAA guideline, but all any information of the customer which is in the electronic shape, like EMR or any kind of electronical information that related to the PHI, that need to be protected. The third one is Health and Human Services HHS 405. So basically, this regulation is a collaborative effort between the healthcare industry and the US Department of Health and Human Service. So they both gonna basically produce security methodologies, procedure, and the processes to the healthcare organization to enhance the cybersecurity and to protect the infrastructure or the services from the security threats. And the couple of the best practices I have mentioned here, like email, endpoint protection, access management, data loss prevention, network management, vulnerability, that all comes in place. All of the security methodologies and procedure need to be defined in this. The next one is the PCI DSS, like the payment card industry. That is also applicable since lots of customers share their card information by doing the payments. So that also need to be secured by Augusta. So we need to comply by this regulation as well. The last one is the quality system regulation, QSR. So since hackers are not trying to breach any kind of medical devices, and especially installed in the Augusta as well, since we are talking about the Augusta, so which often don't have some level of defense. Uh, so we need to make sure all of our medical devices, the firmwares are upgraded, their vulnerabilities have been patched, the access should be authorized, the way we defined for the laptop or the mobile device. So the same way we need to take care the medical equipment as well. So that's how this regulation came in the picture. The next one, organizational efforts and business need. Below are some of the business need to protect the systems, Augusta systems from the breaches. The very first intention is the preventing from the financial gain, and an example is the ransomware attack. So our efforts are to protect our internal system from any kind of financial gain or any kind of ransomware attack. So what they basically do, they lock the system, they encrypt the system, and they ask for the money, right? And sometimes what they do, they steal the PHI information and they publish over the internet some of the information over the internet. They ask for the money to decrypt the files, and that's how like the hospital is screwed up. So we need to always protect our system, and shouldn't be the victim of this kind of ransomware attack. So that's how our business need is, and the organization efforts to prevent from them the financial gains. The next one is the brand damage. If definitely if any hacker gonna hack our Augusta hospital system, so our the hospital name and the brand is going to be damaged. The third one, here I gonna discuss something about preventing Augusta hospital system access. So basically, attacker are basically their intention to gain the access on any assets or any computer system within the Augusta network to steal the PHI data information. So that's how these hackers basically use their skills for a particular goal, and it could be like stealing PHI information, or maybe to bring the network down. So that's how we have to basically make sure all of the security controls are in place, and we shouldn't provide any unauthorized access to any unauthorized user. So that's how recommended company efforts are. We should have the right security people, we should have a right processes, and we should have a right security technologies in place to control these kind of uh, activities in our infrastructure network and application services. And we should comply all of the healthcare laws and the regulation. So that's how security controls will be deployed accordingly. The next one is elements of the cybersecurity risk. Cybersecurity is basically defined into three different components: threats, vulnerability, and the consequences. So, the threat for Augusta Hospital, cyber threats can include social engineering attacks, DDoS attacks, DOS attacks, and advanced persistent attacks. That's going to be the nationwide attacks as well. So these threat actors may be associated with any kind of nationwide inside attacker, external attacker, and the criminal activities or criminal actors are also being involved. So, and they are sometimes motivated from the financial gain perspective, especially in the hospital system, or to hurt the brand as well. So that's how we should be very aware from the threat. That is one of the typical component of the cybersecurity risk. So we should always consider it as a risk. Vulnerability in secure safe cybersecurity, a vulnerability refers to a weakness or flaws or any kind of error that can be exploited by any attacker to gain the Augustus hospital system unauthorized access. And it could be an unauthorized access, or it could be hitting any particular services to bring the services down. So that is where vulnerability can be taken an advantage of, like in a multiple ways. So that's how we need to make sure none of the system would have any kind of vulnerabilities which is giving an intruder an option by using a backdoor to hit our Augusta system services to gain the access or either to exploit the services. Consequences is basically is the actual harm or the damages in the Augusta hospital system that occur as a result of the network disruption. So B, basically it could hit our hospital finance, our operations, our reputation, and regulatory compliance. So we could be having a fines, federal fines as well. So that's how we need to uh, uh, be conscious with this all of the consequences of the cybersecurity risk. So basically, element cyber threat modules help us to mitigate the elements if security risk threats are have been identified. So these cyber threat models basically help us to defend from the cyber threats. Right. So we should be having a proper remediation mechanism. We should be having a proper response mechanism, recovery mechanism, and implementing and testing security policy mechanism, right, to mitigate any kind of threats and vulnerabilities. The next one is the privacy principle. So privacy principle, which there are the three: data collection, data disclosure, and data retention. So when we are talking about the hospital system privacy principle, so PHI information, that is one of the most important thing. So from the data collection perspective, when we are collecting any PHI information, so there should be a limit to how much personal data we need to collect it from the customer. And the data quality, personal data when collected should be accurate and related to the purpose it is being used. It shouldn't be used for any extra purpose. Whatever be the purpose, it's only being used for that associated purpose only. And the disclosure, right, definitely the use of the personal data that from the customer, that should be specified and the customer should be aware about that, and even us, like what would be the disclosure for this. And using the limitation, so data should not be used for the purpose other than that was specified, and the data should be secure. So that's how comes under the disclosure. And the last one is the data retention. A data retention basically defines the policy, why and how you store the data, for how long you need the data, and when you need to dispose that data. So since we are as the hospital and the healthcare industry, we need to store personal health information of our customer, but definitely for any former customers or former patients, what would be our data retention policy in our electronic system. The next one is impact of legal or regulatory standards on the Augusta system. So basically smooth hospital operation as a result of the cybersecurity regulation. So that would be an outcome. So delayed procedure and tasks, that those were the most common reported consequences of the cyber attack. And same thing happened with the ransomware. If we had a ransomware, then definitely most of the patient's procedure and the task going to be postponed and delayed, and we will not be able to respond back to the patients on time. Cyber criminals have recently targeted healthcare providers by stealing patient data. So that's why we should be so much careful, and we should be like protecting our hospital operation, and we need to avoid those kind of threats and the vulnerabilities by implementing cybersecurity regulation. The next is the same. So impact of cybersecurity regulation will outcomes below methodologies. So if we have a right cybersecurity regulation, so these methodology comes in the picture, and we need to keep continuing these methodology, because these are the key insights how our modern cybersecurity attacks are carried out. So like what we need to do, security testing and the examination overview need to be done. We need to review the techniques, target identification analysis techniques, target vulnerability validation techniques, security assessment planning, security assessment execution, and post testing activities. These are the some kind of methodologies we need to execute, and that's going to be help us to secure the system. The next one is the cyber security program. So cyber security lab security provide a guideline to identify the threats before exploitation, and we need to, and cyber security framework basically help us to mitigate those steps. That's all what I have. Hopefully you're gonna like this presentation, and that's all for today. Have a good rest of the day. Thank you so much.